wanted to talk to you a little bit more about GLP-1 medications or semaglutide medications like Ozempic, Wegovy, Mounjaro, lots of different names, Zepbound. So the American Society of Anesthesiologists came out with guidelines just about 2 years ago about how to manage those medications around the time of surgery under general anesthesia. And they recommended stopping them 1 week ahead of surgery. Well, in my practice, I recommend that patients stop them 1 month before for several reasons. Number one is safety. We want to make sure that patients have a completely empty stomach before they go to sleep to prevent the risk of food coming up, going into their lungs, and causing an aspiration pneumonia. And there have been several reports of patients still having undigested food in their stomach for 3 to 4 days, even if they stop their medications 2 to 3 weeks ahead of surgery. So in my practice, we just said a month. After surgery, it's also important to not go right back on those medications right away. And the reason has to do with nutrition and wound healing. And think about it. If you have food which gets hung up in your stomach for a couple of days, it gets broken down by your stomach acids, and then it takes several days for it to move into the small intestine, which is where your body extracts all the nutrients. By the time the food makes it into your intestine, a lot of the nutrients have been destroyed and you don't get the benefit of food, meaning the nourishment you need for healing. Unfortunately, we have seen some wound healing complications several years ago when patients started going on those medications. They didn't disclose to us that they were on those drugs and we didn't specifically ask. So now for new patients, we actually had to add a new category in our intake forms where we specifically ask about use of those medications so that we can help patients manage the drugs they're on around the time of surgery, not only for safety, but also to ensure the very best wound healing. We recommend that patients don't restart semaglutide or GLP-1 medications for at least 1 month after major surgery, and sometimes longer if they're having wound healing issues. I have a blog post on my website that goes into a little bit more detail about safety issues with Ozempic and medications like that. And to learn more, visit my website.